Brazil declares a false end to the pandemic. On April 17, the fascist President Jair Bolsonaro's administration declared the expiration of the health emergency order issued in February 2020, thereby ending all limits on the COVID-19 epidemic. In a nationally broadcast address, Health Minister Marcelo Queiroga hypocritically claimed that the Unified Health System, SUS, saved many lives despite conceding that the globe is still experiencing the largest health crises in history. The new Bolsonaro decree's criminal consequences were questioned by epidemiologist Ethel Maciel during an Oswaldo Cruz Foundation meeting, Fiocruz. The decision to stop the health emergency in Brazil may spark a fresh epidemic, as it has in the US, UK, and other nations. This subvariant is highly transmissible, according to the All for Health Institute, ITpS, on April 14. On March 19, 27.2% of positive tests were from the subvariant. Many scientists and health specialists have warned about the consequences of lifting the emergency order. This subvariant contains traits of BA.1 and BA.2. On April 16, the state of Rio Grande do Sul verified the first occurrence of recombination of Delta and Omicron subvariants. Richard Steiner Salvato, a state genomic surveillance expert, underlined the need of tracking these variations' progress. People in the ruling class want to stop fighting the virus. They say that after SARS-CoV-2 and Omicron spread, the pandemic has become a permanent part of our lives, so we should stop fighting it. Governments throughout the globe use the word to stop all control measures and reduce resources required to manage COVID-19 patients. With no way to forecast the virus course or plan for any reaction, this strategy of herd immunity essentially eliminates any capacity to predict and prepare for a pandemic. The Biden administration has decreased funds for free testing and immunizations for uninsured individuals, while criteria are being developed to eliminate tens of thousands of fatalities from the U.S. Centers for Disease Control (CDC) list. This month, Boris Johnson's administration discontinued free test distribution, and other antivirus measures, such mandating self-isolation for positive tests, have been abandoned since February 24. Hospitalizations nearing records and over 2,300 fatalities in the previous 7 days show the true effect of BA.2. An assault on the Health Ministry website on December 10 halted the counting of new cases, fatalities and vaccinations. Bolsonaro redoubled his opposition to any remaining mitigating measures and to the use of vaccination certificates to limit foreign entrance before the New Year and Carnival festivities. He also threatened to have parents get a medical prescription for their children's vaccinations. However, governors from all parties, including the self-described left, agreed that school must resume as soon as possible. After the Omicron variant wave passed in January to February, state governors joined Bolsonaro in ending obligatory indoor masking in March. Because of the recent proclamation of the end of the health emergency, the endemic narrative's actual meaning becomes clear. The people must embrace a new normal of mass infections, deaths, and suffering with extended COVID. For the Brazilian bourgeoisie, the Bolsonaro government and the governors constitute an uncomfortable reminder that the epidemic is not finished. Their purpose is to keep employees sick in order to increase revenues. It is vital to fight these unscientific actions. Continuing large-scale infection increases the possibility of emerging variants with greater virulence and vaccination resistance. The COVID-19 pandemic will stop only when the novel coronavirus is eradicated globally. The actions of the Workers' Party (PT) governors, who reopened businesses and schools with Bolsonaro, prove that re-electing former President Luiz Inácio Lula da Silva's administration would not solve the epidemic or any of the pressing issues facing the Brazilian working class. In April 2020, although Bolsonaro reiterated no public health response to the outbreak, Congress passed a multi-billion-dollar bailout plan for large corporations, with just a fraction of that amount going to working people. To halt the epidemic, the working class must form rank-and-file committees under the International Workers' Alliance of Rank-and-File Committees, IWARFC. On May 1, the Fourth International Committee will offer a program to halt the epidemic and end the imperialist war in Ukraine. We encourage all Brazilian and foreign workers to come.